Module Overview. Nutrition is the foundation of healing, energy, immune defense, and overall quality of life, especially in patients who are ill, immobile, or recovering. In bedside care, the role of caregivers goes beyond just offering meals. It includes ensuring patients receive, digest, and utilize nutrients effectively while upholding dignity, safety, and medical dietary restrictions. This module explores the principles of nutrition in the healing process, different types of patient diets and feeding methods, hands-on assistance techniques for dependent patients, how to prepare and present meals at the bedside, feeding safety, choking prevention, aspiration precautions, cultural, ethical, and documentation aspects of feeding care. This module is vital for reducing malnutrition, preventing feeding-related complications, and supporting patient recovery in hospital, elderly care, palliative care, and home settings. Understanding nutrition in patient care. Nutrition includes macronutrients, carbohydrates, proteins, fats, and micronutrients, vitamins, and minerals, along with hydration. For hospitalized or immobile patients, good nutrition speeds wound healing, maintains muscle mass and prevents bed sores, supports immune function, prevents malnutrition and dehydration, improves mental alertness, mood, and general well-being. Undernourished patients are at higher risk for falls, pressure ulcers, infections, prolonged hospital stays, and mortality. Common types of diets in patient care. Diet type, purpose, example. Regular diet, normal intake with no restrictions. Soft diet, easy to chew and digest for weak patients. Clear liquid diet, for post-op or digestive recovery. Broth, juice, tea. Full liquid diet, includes milk, cream soups, puddings. Diabetic diet, regulates sugar and carb intake. Low sodium diet, controls blood pressure and heart conditions. Renal diet, for kidney patients. Limits, protein, sodium, potassium, mechanical soft. For patients with chewing, swallowing difficulty. Pureed diet, for severe dysphagia or after stroke. NPO, nothing by mouth. Patients not allowed oral intake pre-post surgery. Caregivers must strictly follow dietary instructions from physicians or dietitians. Feeding assistance techniques. Feeding a patient requires skill, patience, and sensitivity. Key steps include hand hygiene for both patient and caregiver. Position patient upright, minimum 45 to 90 degrees, to avoid aspiration. Ensure proper dentures or oral cleaning before feeding. Present food attractively, using small portions. Feed slowly, using small spoonfuls. Allow time for chewing and swallowing. Observe for swallowing difficulty, coughing, gurgling, throat clearing. Offer fluids regularly, unless restricted. Maintain conversation or calm encouragement to promote intake. Document intake quantity and any difficulties. In patients with dysphagia or neurological conditions, thickened liquids or special techniques may be prescribed. Tube feeding, overview. Although a caregiver may not insert feeding tubes, understanding NG, PEG, or jejunostomy tubes is important for monitoring and assistance. Responsibilities may include ensuring correct positioning during feeding, monitoring for aspiration, nausea, or reflux, checking feeding schedule, cleaning external components, and reporting issues. Strict hygiene and sterile technique are essential to prevent infection. Bedside meal preparation. Some care settings may require caregivers to prepare and serve simple meals at the bedside. Guidelines include following patients' prescribed diet, ensuring temperature appropriateness of meals, avoiding cross-contamination, gloves, separate utensils, using non-perishable snacks or therapeutic nutritional supplements, managing portion control to prevent waste or overfeeding. In rural care, home settings, or elderly homes, this task may include blending, microwave heating, or thickening liquids. Hydration and fluid balance. Water is life. Patients with poor mobility or decreased thirst are at risk of dehydration. Signs of dehydration prevention. Tips: dry mouth, dark urine, sunken eyes. Offer fluids hourly, unless restricted. low blood pressure, use hydration charts, dizziness, confusion. Encourage sips during meals, rapid heartbeat, provide variety, juice, broth, oral rehydration. For patients on fluid restrictions, e.g., heart or kidney disease, caregivers must monitor strict intake output balance. Cultural, ethical, and emotional considerations. Respect religious food restrictions, halal, kosher, vegetarian fasting. Consider patient preferences, spices, timing, favorite foods. Never force or ridicule a patient who refuses food. Be mindful of emotional eating, grief, or anorexia in palliative care. Feeding safety and choking, aspiration. Prevention. Never feed lying down. Always elevate head. Know the Heimlich maneuver in case of choking. Use suction devices or call emergency if patient aspirates. For known swallowing disorders, thickened liquids or therapy may be required. Document any signs of coughing, vomiting, breathlessness during meals. Legal and documentation standards. What to document, why it matters. Food fluid intake, in milliliters or percent consumed. Assesses nutrition balance, refusals or difficulties, flags potential issues. Vomiting, coughing, aspiration required for nurse, doctor follow-up, feeding time and caregiver name, accountability and records. Any emotional or behavioral issues assists mental and nutritional assessment.